Imagine a humble, unassuming garden shed in the English countryside, nothing flashy, just a simple brick and rubble-stone structure topped with a thatched roof that sparked a revolution in medicine, forever altering the landscape of global health and sparing millions from deadly diseases. This is the story of Edward Jenner's Temple of Vaccinia, now perilously close to ruin and newly listed on England's Heritage at Risk register. But here's where it gets intriguing. Could this ordinary hut, where modern immunology was born, be slipping away just as its legacy continues to save lives today? Let's dive in and explore why this matters, and perhaps uncover some surprises along the way. Edward Jenner, born in 1749 and passing in 1823, is hailed as the figure who has rescued more human lives than any other through his pioneering work. In the late 18th century, right in this modest Gloucester hut, he conducted the world's first vaccine trial against smallpox, a disease that ravaged populations for centuries. For those new to the concept, immunology is the study of how our bodies fight off infections, and vaccines work by training the immune system to recognize and combat harmful pathogens without causing the full-blown illness. Jenner's breakthrough was groundbreaking. He noticed that people who caught cowpox, a milder ailment from cows, seemed immune to the far deadlier smallpox. So, he took pus from a cowpox sore on a milkmaid's hand and inoculated it into a small incision on the arm of an 8-year-old boy named James Phipps. Then, he deliberately exposed the child to smallpox, and remarkably, the boy remained healthy. This simple experiment changed everything, laying the foundation for vaccines that we still rely on today, from polio shots to COVID-19 jabs. And this is the part most people miss. The hut wasn't just a lab, it was the site where villagers queued up in Berkeley, Gloucestershire, to get scratched with a lancet and receive this life-saving protection. Yet, despite its historical significance, the hut is deteriorating badly. Owned by a charitable trust, it urgently requires fixes to its thatched roof, rear wall, and chimney to prevent further decline. Historic England, the organisation overseeing England's historic treasures, has added it to their annual Heritage at Risk register alongside 137 other endangered buildings and sites. This list acts like a health check for the nation's past, highlighting places in jeopardy while celebrating recoveries, like the removal of 129 sites this year, including the magnificent Papplewick Pumping Station in Nottingham, a Victorian engineering masterpiece that once powered water supply systems. Claudia Kenyatta, co-chief executive of Historic England, expressed amazement at the hut's pivotal role. "It's astonishing to think how this shed shaped history as the world's first vaccination clinic," she remarked. Listing it on the register isn't just a warning, it's an opportunity to rally attention, expertise, and resources to protect these vital sites. And this is where things get controversial. While Jenner's work is celebrated, some might question the ethics of his methods, especially experimenting on a child without modern consent standards. Was it a necessary step forward, or does it raise red flags about exploitation in the name of science? It's a debate worth pondering. Does innovation sometimes require uncomfortable sacrifices? The register isn't all doom and gloom, it's designed to inspire action and creative reuse of historic spots. Being listed can be a positive turning point, Kenyatta added. It unites communities to brainstorm solutions, breathing new life into these irreplaceable places. For instance, take the Bruce Grove public toilets in North London's Tottenham, built in 1910 and once abandoned in the 1980s. They've been transformed into a vibrant cafe, community hub, and even updated restrooms. In Gloucester, England's largest surviving timber-framed townhouse got a facelift and now houses an antique centre. And in Cumbria, the Orgill smelting mill near the A66 has been preserved through conservation efforts, fostering volunteer training, local engagement, and a deeper appreciation of the area's mining history. Other newcomers to the at-risk list this year include the Hill Garden Pergola on London's Hampstead Heath, a 1906 elevated walkway in a once private garden crafted for soap tycoon William Lever, later Lord Leverhulme, a testament to early 20th century philanthropy. Then there's St Wendrada's Church in March, Cambridgeshire, the UK's only church dedicated to a 7th century Anglo-Saxon princess saint. Its bells are silenced due to a collapsing roof. And at Cromford Mills in Matlock, Derbyshire, 2 cottages are endangered parts of the site where Richard Arkwright invented the first successful water-powered cotton spinning mill in the 1770s, birthing the factory system that shaped industrial revolutions worldwide. Heritage Minister Fiona Twycross, a Labour peer, praised the recoveries. "It's wonderful to see these cherished sites revived for communities," she said. "Our £15 million Heritage at Risk Capital Fund has played a crucial role this year in rescuing gems like these. So, what do you think? Should we prioritise saving historical sites like Jenner's Hut, even if it means debating the moral ambiguities of their origins? Is the risk register a smart way to protect our past, or does it sometimes overlook cultural sensitivities? Share your thoughts in the comments. Do you agree that places of scientific triumph deserve eternal care, or should we focus on modern innovation instead? Let's keep the conversation going.